So Avil, Kamal, Meera, sorry, Rifa, Simiat. Okay, we are going to have a very special session. Yes. So this session is devised by our coordinator, Meera. So she is preparing sessions for everyone. Right. It's her hard work. She has made some points. She has made on dialogue, and based on that, when those dialogues will be given to you. Yes. Right. So get ready for the speaking sessions. Stroke. Stroke. Right. So this is the card of this. So this is the card. So this is the patient's card. This is for today, 26th November 2023. Practice session, theory and practice. This is the patient card, and this is the nurse card. Right. So view full screen. This is the nurse card. Yeah, this is the card. Yes. So this is the nurse card. This is the patient card. Okay. The role players card of the patient's card. Right. So there it is. So you can prepare. You take 3 to 5 minutes because we are going to have a launch pad for success. Yes. So go through the card and study. Yeah. Now you think, okay. Think about everything. Now I will ask you some questions. and you have to answer those questions. Right. So I'll ask you some questions and you have to answer the questions. Okay. So what is the setting, or what is the background or backdrop? What is the setting? Is it a clinic, or is it a hospital, or is it a reception, or is it an emergency hospital? What exactly it is? Is it a home? Okay. What exactly it is? Yeah. Hospital ward. Okay. That is number one. If you answer these questions, you'll get an idea about what we are talking. Right. Now, so with whom are you talking? Who are you talking to? Who are you talking to? Are you talking to the patient? Or are you talking to the patient's mother or father or caretaker? Who are you talking to? Who are you talking to? So you're talking to a patient. Okay. How old is the patient? How old is the patient? How old is the patient? He is 63 years old. Okay. Now he is in the hospital ward, or she. Now, do you know what is the gender of the patient? What is the gender of the patient? Yeah. How do you know that it is male? How do you know that it is male? Yeah, he. Otherwise, he would say he or she. Okay. So he is there. But actually, this will not be gender specific sometimes. So just the patient is like that, they will say. In the beginning, it is patient, but he is given. Very good. So male. Right. Now, so now what is the present condition? Is it admission, or is it during hospitalization, or is it a discharge? What exactly it is? Or is it a referral? What is the present status? Is it admission, or is it during hospitalization, or is it discharge? Yes, ready to be discharged, or ready for a discharge. It's not ready to discharge, it is ready for a discharge, or ready to be discharged. Okay, the status is discharge. Okay, now, so he is ready to get a discharge. That means he was admitted. So where is he now? Where is he now? Where is he now? Where is he now? So in the ward. In the ward. That means, was he admitted, or was it a visit? Is it an admission, or is it a visit? Yeah, it is an admission. What type of admission? Okay, admission or visit? Admission or visit? So you said it's admission. What type of admission was it? What type of admission was it? Yeah, you have to analyze all these things. Yeah, what type of admission was it? Uh, so, emergency admission. Okay, how was he brought? How was he brought? Do you know what is BIBA? Now here, yeah, he was brought by an ambulance. Do you know BIBA? What do you mean by BIBA? It's a special phrase in medical terminology. BIBA is abbreviation. Even in writing task notes, you will face this one. BIBA in shortcut. What do you think is this BIBA? Do you know? Anybody can type it. BIBA. Can anybody write the 4 letters full? BIBA. What do you mean by BIBA? Anyone? Yeah. Brought in by ambulance. Very good, Simiyat. But you should not use capital letters. You should use small letters. If you want using capital letters, you have to write like this. BIBA in capitals or brought in by ambulance, small letters. That's it. Okay. Now next one. Yeah. What was the test performed? Okay. What was the test performed? Test. What was the test performed which confirmed this problem? Yeah. CT scanning. What do you mean by CT? CT means what? What is the full form of CT? You should be ready with this. You cannot write CT. Okay. CT means what is the full form of CT? What is the full form of CT? Yeah. What is the full form of CT? This is going to be a very special session. Don't miss from the beginning to the ending. Yeah. So computerized tomography scan. Very good. Okay. Now CT scan showed he had a stroke. So confirmed the diagnosis. Okay, confirmed. You can say confirmed. So CT scan confirmed the diagnosis, confirmed that he had a stroke. So stroke was confirmed by CT scan. Stroke was confirmed by CT scan. Yeah, right. Then next one is the next question. So the condition was serious, so he was admitted. Now his condition, how is his condition? Is it still serious? Is the condition, how is his condition now? Is it serious? The condition is stable. The condition is stable. Okay. Condition became stable with what? With what? Stable. What is the reason for stability? Stable with what? Yeah. Stable with the medication. Okay. Is stable with the medication. Yeah. 1 second. Think about this card. Give me 30 seconds. This is the background. And what about the future now? About the future. Now, after a discharge, what type of treatment is needed? Is it short-term treatment or long-term treatment? So what type of treatment does he need? What a treatment? Short-term, short or long-term treatment? Short-term treatment is required or long-term treatment is required? So long-term treatment. With what? What is the treatment? Is it medication or what exactly is needed? Short-term, long-term treatment. Okay, long-term treatment with what type of medication? What is the name of the medication? What is the name of the medication? Okay, medication. What is the name of the medication? Warfarin. Okay, warfarin is the made of medication. It is not short-term. It should be long-term. Long-term. Okay, it's not temporary. It's long-term. And what is the quantity of medication? How many times a day? Is it daily medication or weekly medication or daily twice? What is the duration and how much medication? Daily. Okay. How much medications? So 6 milligrams per day. 6 separate milligrams separate per day. Okay, fine. So 6 milligrams per day. All of you respond. If you respond only, you will remember. Okay, 6 milligrams per day. Right? Very good. Yeah, right. 6 milligrams per day. Now, and what are the other tests that are required? One test before okay, admission for stroke. A CT scan was done after admission, maybe. So it was diagnosed. What is was diagnosed? Stroke was diagnosed. Then now he was stabilized. Now in the future, what are the tests that are required in the future? So periodic tests, maybe weekly or monthly tests. Okay, on a regular basis. Yeah, regular blood test or tests, singular or plural, Dalvi. Singular or plural. It is not one test. It's many times he has to do the test. One, yeah. So blood tests. Okay, regular blood test, maybe one weekly once or monthly once or fortnightly once. We don't know exactly, but regular blood tests are there. The information is not very clear in the case notes. The information is not very clear in the case notes. You are medical professionals, so you can tell me it will be weekly or if any doctors are there, doctors can suggest. Let me check if any doctor is there. Doctor, any doctor is there, you can tell. Otherwise, nurses, you also can tell, no problem. Okay, the tests will be weekly or monthly or fortnightly, once in a week or once in 14 days or once in a month. You can tell me, will it be weekly tests or fortnightly tests or monthly tests? Okay, so what do you think? Right, it may be weekly or monthly or whatever it is. Very good. So that's good. Right. It may be anything. That's okay. According to your expectations, you can use those words. Okay, because the information is not very perfect. The information in the case notes is not very strong. So it has some weak areas. Okay, now let us see. Now, the first question. Now here, what is the first task? Now, first introduction will be there. In the introduction, what will you do? Don't write the entire sentence. Introduction. Okay, in the introduction, what will you do? Introduce yourself, confirm the patient, and ask him what, just some points. Don't write the sentences. Just what you will do. What is your motto in introduction? Self-introduction. Maybe you'll introduce yourself. Okay, then what else? Confirm the details of the patient. Yeah, self-intro. Very good. Then what else? Yeah, then what else? Yeah. Yes. Come on, all of you, write down whatever you think you will ask in the introduction. Confirm the patient's details, right? And the purpose why he is present. Confirm. Yeah, you are right. Confirm the name and confirm the details of the patient. Confirm the details of the patient, his age, his name, and then you'll confirm the purpose of the, okay, purpose of the visit. Check what's the purpose of the visit. Okay, fine. That's very clear. Then next, second one, task one. Task one, first task. There are 4 tasks here. Okay. Ask the patient what they know about strokes. So number 1 is eliciting the information from the patient. Eliciting the information from the patient regarding his prior knowledge about stroke. About a stroke. Eliciting the information from the patient regarding his prior knowledge about a stroke. What he knows about it. That's it. That is task 1. Okay. Eliciting information. The patient. I am the patient. My name is, what is my name? Michael Jackson. Okay. Or Abraham Lincoln. Or some other name. Okay. So now you should ask me what I know about stroke. That simplifies your task. If I know something, you can eliminate that one and you can tell what he does not know. What he already knows, you tell him that there is no meaning. Okay, involve him in the speech, involve him in the direct conversation. That's very, very important. Okay, next one. Okay, next task number 2. Task 2. What is task 2? Task 2 or question 2 in the task. Question 2, we can say, explain what causes strokes. Explain what causes strokes. So you are going to provide information. So provide in the task 2, you are providing the relevant information. Providing relevant, okay, information. Providing relevant information regarding information about the reasons, okay, what causes stroke, reasons. So reasons for stroke, information about, okay, relevant information about, you are providing relevant information about 3 different things here. No, 2 different things. First one is causes of strokes, causes. So you are giving what causes strokes. What causes strokes? What are the reasons for a person to get strokes? Number 1, reasons. And next one, what medication is required if a person has thrombosis? What is the medication required? What is the medication required for preventing strokes in the future? What is the medication required for preventing strokes in the future. Okay, that is number one. And medication for treatment of thrombosis, both medication for prevention in the future, medication for treatment of thrombosis. Okay, prevention in the future and present treatment. So present treatment and future prevention. Present treatment. Okay, medication required for present treatment and future prevention. Future prevention, present treatment and future prevention. Both of these things you have to talk. So you have to explain, okay, the causes of strokes, and you have to talk about medication for preventing the present treatment of the present condition, and also preventing for the future. That's what long-term treatment of warfarin for the prevention in the future, and present treatment what you have given. So two things are different here. Two things are different. The next one, task 3, or we can say question number 3. Task 3. Task 3 is reassurance, offering reassurance. Offering reassurance. This is the third task. First one is seeking information or eliciting information. First one is called eliciting information. First one is eliciting information. So number 1 is eliciting information. What the patient already knows. Eliciting information. Okay, that is number 1. Eliciting information. Number 2 is providing information. Providing additional information. Okay. Providing information. Eliciting information what he knows. Providing information what you know and what the patient does not know. And the third one is offering reassurance. So you have to make these points. These are very, very important points. Offering reassurance. Offering reassurance. And the fourth one is, okay, now we are, the third one is, fourth one is suggestions. Providing advice, suggestions, recommendations. So recommendation necessary, giving suggestions, giving suggestions. Okay, these are the 4 different things. And in the third one, task 3. Okay, task 3, what you are doing is reassure the patient about his current condition is stable. Now no need to worry. Offering reassurance. Okay, offering reassurance means, so he is in an uncomfortable situation. You are offering reassurance. You are making him comfortable by saying that the present condition is nothing. There is nothing to worry. Present condition, it is stable. There is nothing to panic. There is nothing to panic about in this condition. That's what you are going to tell. There is no problem. You are in safe hands. Everything is set properly now. There is nothing to worry. Everything is brought under control. All these words, they're already on the YouTube. You can get and use them. Right. That is number 1. Emphasize the patient of the doctor's orders to have regular blood tests. So, future course of action. Future course of action. Now it is okay, but future you have to take some precautionary measures. Precautionary, we can say precautionary measures. You can use these words. You can use these words also. Precautionary measure. As a precautionary measure, you can take future course of action. So what are they? They include now the doctor's orders. So the doctor's recommendations. The doctor's recommendations. All these words, whichever I'm typing in bold, you can use. The doctor's recommendations. The doctor's recommendations regarding what? Number 1, regular blood tests as scheduled in advance. It may be weekly or fortnightly or monthly. Make it full session. Okay, let us make it fortnightly or weekly or monthly. Okay, now Why these tests? Blood tests, why? So that everything is normal. To ensure, to make sure that everything is fine, which will ensure she is closely monitored. Okay, because if you take blood test, then you will know what your results are. Then these results you will information you will pass on to the doctor or the nurse, and they will discuss, and then what course of action they have to take. So regular blood tests should be you have to comply with these regular blood tests. And then number 2, regular monitoring. Regular monitoring. Okay, closely monitored. Okay, number 3, and follow up visits. Follow up visits. The doctors will tell when you have to visit again. Follow up visits. So you have to attend the clinic for follow up. So I think you are very clear with these things now. I think you are very clear with this. These sessions are very, very important. You just attend the session. That's not sufficient. That's not sufficient. You have to attend. See, I have given you some points now. So those points, let us take here. Speaking sessions, stroke. So number 1. Okay. First one is what? So task 1. So we can take it as phases. Phase 1. Phase 1. In the phase 1, okay, in the phase 1, what you will have? Phase 1, eliciting information. Okay, the patient might be knowing a lot of things, so you are going to elicit that particular information. Okay, yeah, you are eliciting information from the patient. This is phase 1. Eliciting information. This is phase 1. Now, what is phase 1? We are going to discuss all this phase 1. Okay, and phase 1, right? So phase 1 is eliciting information. Okay, so phase 1, number 1, eliciting information. Eliciting information. Now if you see, so now let us see here. Ask the patient what they know about strokes. Ask the patient what they know about strokes. Yeah. Ask the patient what they know about strokes. That's it. Ask the patient what they know about strokes. That's it. So that is phase 1. Now, phase 2. Phase 2 is providing information. This is a two-way discussion. First one, he will tell you what he knows, then you will tell him what he does not know. Okay, providing information. So phase 2, providing information. What you know about it. Okay, what he has to know. Okay, explain what causes strokes. Explain what causes strokes. Okay, and what is medication is for, and what the medication is for, and what the medication is for, in brackets, i.e. prevention and treatment of thrombosis, i.e. prevention and treatment of thrombosis. Yeah. Prevention and the treatment of thrombosis. Yes, that's it. So that is phase 2. That is phase 2. Yeah, thank you very much. Yeah, thank you very much. Next one. Yeah, thank you, Avil. So that is phase 2. Next, we will go to phase 3. Phase 3. In phase 3, what are you going to do? Phase 3, reassuring patients, offering reassurance. Offering reassurance. That means he is not comfortable. They are making him comfortable. So, offering reassurance. Number 3, offering reassurance. Offering reassurance. Now, what is this offering reassurance? Reassure the patient that his her condition. See here, I don't know who prepared this case notes, but here he and here his her. I told you, no? So this is not very authentic, but it's okay. 75% okay, we can consider it. Okay, there is some confusion. So his her. That means it may be male, it may be female. So be ready for anything. Here he has to say he or she, his or her. Everywhere it should be there like that. So that's it. So now let us see. Yeah. Let me take the case notes here. Okay, nurse card. Okay. Yes. Now here, reassure the patient that his her condition, current is stable. Emphasize the patient of the doctor's orders to have regular blood tests, comma, which will ensure he is closely monitored in order to prevent another stroke. So reassure the patient that her current condition is stable. Okay. Says the patient of the doctor's orders. Emphasize the patient of the doctor's orders. To have regular blood tests, which will ensure she is closely monitored in order to prevent another stroke. Yeah. So this is the point. That is the third task. Next, we have the fourth task, phase 4. Phase 4. Phase 4 is advice. So suggestions, giving suggestions. Giving suggestions. Okay. Four. Giving suggestions. Advise the patient of preventive measures such as losing weight. So these are the 4 things. Now, next one is phase. The commencement. The commencement, the starting. Okay. So you can say the introductory part. Introductions. Okay. The closure. The conclusion. The conclusion. Yeah. Now I hope you understood all the 4 stages. I hope you understood all the 4 stages. My goodness, I need some water. Okay. Yeah. Before we go into the scheduled discussion, now this is the division, the separation. Now before we go into the scheduled discussion, yeah. So the various parts, 6 parts. So the introduction, first one is the introduction. That means the starters. The introduction or the starters before a meal, before we actually start the meal. The starters, we say. What are the starters? Starters may be soup, or there may be something lighter, okay, drinks or something like that, cool drinks or whatever. So the starters, okay, we can warm ups. Then now in this, after this one, we have 4 phases. The 4 phases, because 4 tasks are there, and then the conclusion. The 4 phases is the main course. The main course, the actual meal, the dinner. Then last one, the conclusion. The conclusion, we can call it as the dessert. Okay. After eating everything, we'll have ice cream or fruit salad or something else. Okay. Kheer or something like that. So now here, have you understood these 6 phases? If you have understood, you can just say a yay, or you can give a nay. If everything is clear, we'll go into the direct discussion. Yeah. Fine. So let us see who are there. Vinita, Srija, Simya, Rifa, Kamal, Hafsa, Dalvi, Avil. Yeah, very good. So these are called the phases, which are very, very important. Very, very important. Yeah, Rifa, it will take some time. Okay, it will take some time. Right. These sessions are very beneficial. Right. So now let us see. Now let us start the discussion. The introduction. The introduction. Now here is the introduction. Okay, eliciting information. So before this one, the introduction. Yeah, introduction, the introduction. Come on. How are you going to introduce? Okay, you want the writing task. Okay, I'll give you. I'll give you there. This is the nurse card. So those who attend the today's session are going to definitely, yeah, yes, this is the nurse card. Yeah, this is the patient's card. Okay, fine. Yes. Now here is the nurse's card. Yes. So we are going to face the commencement or the introduction. Yes. Now here it is. Yeah. You can give your introduction, please. Give your introduction. All of you. Introduction. Give your introduction. Write. Write up your introduction. Rifa. Myself, Rifa. Yeah. Come on, write up. You should not say myself. You have to say my name is or I am. Myself is wrong usage. Myself is a reflexive pronoun. I hurt myself. Myself will never come in the beginning. I hurt myself. It is after a verb you have to use. Okay, I am Rifa or my name is Rifa. Both are correct. Or Rifa is my name. My name is Rifa or I am Rifa. Come on, give your sentences. Yeah, come on. Write down your sentences. Yes. Srija Ravindran. Srija Ravindran. Yeah. Write down all your sentences. Yeah. So, Avil Kenwith, for the verification purpose, could you please detail me your name and age above? It is not a verification, it is verification. Avil, spelling mistake. VERI, not VARI. Correct your spelling. Next one. Write 10 times. Spelling mistake. Yeah. Vinita, this is a known case. This is a known case. Yeah. Good morning, John. I am Srija Ravindran, your attending nurse for today. How are you doing now? I'm glad to inform that you will be discharged today. Very good. Come on, write down. Write down fast. We don't have too much time. Yeah. Yes, everyone write your sentences. If anybody doesn't know, see the others and you try to write like that. Yeah, Vinita. Good afternoon, Peter. I am Vinita. I am are two separate words. I separate, am separate. I am a registered nurse working. I am both the times it is I am together. Why together? It should be I separate, am separate. Vinita, okay? I separate, am separate. Mind that. I am a registered nurse working in this ward. I will be looking after you today. How are you? Hmm. Yeah. Next one, Rifa. Good afternoon. I am Rifa, your nurse to answer your doubts and advise you regarding the issue. I am Rifa, the attending nurse. I am ready to answer your doubts and advise you regarding the issue. Issue is finished, you know. Okay. If you have any concerns like that, you can say. You can proceed with my questions. You can proceed with any questions. You have been advised for discharge. I will be providing you with the details. Yes. Fine. Come on. Kamal Thakkar. I'm here to discuss about your discharge plan and treatment plan. Where is your introduction? I am Kamal, like that. Something should be there, na? Where is that? Yeah, discharge details. Okay. Come on, give the introduction. Give the introduction, all of you. Very good. Very good. Very good. Yeah, in the beginning, Kamal Thakkar. Good evening, Mr. Peter. You already told here. I am Kamaljit Kaur. I am your assigned nurse for today. I am Rifa. Good afternoon. My name is Yogendra. I am one of the registered nurses. I am the one of the registered nurses. I am Yogendra. I am, not I am. I am registered nurses working here in this hospital ward. Good afternoon. I am Avil, one of the registered nurses working in this hospital for the verification purposes. Okay, right. Very good. Come on. Yes, please. Yeah. So that is introduction. Okay. Then I am telling you now. My name is Michael Jackson. Okay. My name is Michael Jackson. Remember that. Michael Jackson, the dancer. Good. Okay. Michael Jackson. Fine. So this is my name. And yeah. Now what I'm going to tell you is, you are right, nurse. I was informed by the doctor. In fact, in fact, I do not have any idea about stroke. I was shocked when I heard about it. How is that possible? I have typed my answer. You asked me many things. You are right, nurse. I was informed by the doctor. In fact, yeah, I told her I am. My name is Michael Jackson. Okay. So you can say Mr. Jackson or whatever you want to say. Yes, that is my name. I'm already a known case to you. I'm in the ward. Maybe I'm not a known case to you because you have newly come and first time you are seeing me. Okay, possible that also. Don't think that it is always a known case. For some nurses, it is known case. For some nurses, it may be not known case. Okay. Yeah, but you know only from the case notes. Maybe that is also possible. Yeah. Now respond. Now, what is the next point? Eliciting information. Ask the patient what they know about strokes. Yeah, I already gave you the point. Okay. Already told you. You're right, nurse. I was informed by the doctor. In fact, I do not have any idea about stroke. I was shocked when I heard about it. How is that possible? So, yeah. And then I don't know really. So, what are strokes? What causes them? I'm surprised. That's it. Why did I get this stroke, nurse? What are the causes of strokes? Can you please explain me all the important things related to my medical condition? I need to know every important detail because it concerns my life. Yeah, now it is your turn. So, yeah, I'm going to even give the, I will type the sentence which our coordinator has written. Yeah. So nurse, I'm writing the dialogue here. Nurse. Good afternoon. You can write your answer to my statement. Good afternoon. Okay, so you have to, from here, explain what causes strokes and what the medication is for. So this is phase one. The patient, what they know about the strokes. You have to elicit information. Okay, so I said I know nothing. Then phase two, providing information. Explain what causes strokes and what the stroke medication is for, i.e. prevention and treatment of thrombosis. Okay, now this is the card for you, patient's card. So good afternoon. Good afternoon. Mr. Jackson. My name is Meera. Sorry, my name is, we'll take a fictional name. This is what she has given, sample. So my name is, what name we'll give? We'll give some fictional name of a nurse. What name we'll give? Somebody suggest a name, na? So my name is, um, hmm. Okay, Venice. Venice is the name of a city, Rifa. Can be the name of a girl also, na? Okay, we can take the name Patricia Stiles. Okay, let us respect Rifa. Venice is the name. Okay, Venice, the name of the candidate and family name. My name is Venice. Right. Venice Right. Okay. My name is Venice Right, and I am one of the registered nurses working in this hospital ward. Hospital ward. Hospital ward. Full stop. Based on your case notes, you have, I come to know that you have been diagnosed with a medical condition called stroke. Okay. Are you aware of that? So that is the sentence which our coordinator gave. Then next one, Michael Jackson. Michael Jackson. Now Michael Jackson answered. This also what she has given. You are right, nurse. Stop. I was informed by the doctor. All of you write your sentences. You're right, nurse. I was informed by the doctor. I was informed by the doctor. Full stop. In fact, I do not have any idea about stroke. I do not have any idea about stroke. I was shocked when I heard about it. How is that possible? Question mark. So that's it. So there you are. Yeah. So this is Dalvi Yogen. Mr. Jackson, I totally understand your concerns, but no need to worry about it. Your condition is stable now. Stroke is not a stroke. A stroke is a health condition that can occur to anyone at any time. But now you have to take care of your health. And also you have to pay attention to your diet and weight. Very good. Srija, yes, Mr. Michael, I can really understand your concerns. Again, I'm here to explain everything related to stroke. However, before that, let me know what do you know about stroke. Let me know what you know about stroke. Okay, that's fine. Yeah, all right. That is next step. Nurse. Next, nurse. Yes. So what I'll do is I'll type here. This is fast enough. I can read it out. I would be upset if I were in your position. The expressed concerns are undoubtedly reasonable. A detailed explanation will be provided. Stroke is a medical emergency. It can occur when blood flow to the brain is blocked. Prognosis is excellent if we diagnose it early. Medication, which has been commenced, needs to be continued. Adherence with the medication regimen is considered imperative, not only for preventing further clot formation, but also for the treatment of the current thrombosis. There may be spelling mistakes, no need to worry. Okay, because I read it out and artificial intelligence typed it. Okay. What I'll do is same thing, I'll copy here and post here and the correction, make the necessary correction. I would be upset if I were in your position. The expressed concerns are undoubtedly are, undoubtedly reasonable, reasonable. Otherwise, you can bring undoubtedly to the beginning. A detailed explanation will be provided. Stroke is a medical emergency. It can occur when blood flow to the brain is blocked. No mistakes. Full stops also came. Prognosis is excellent if we diagnose it early. Medication which has been commenced need to be continued. At the end, full stop. And where did this come at the end? Adherence, 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 adherence with the medication regimen. Adherence with the medication regimen is considered imperative. Is considered imperative not only for preventing further clot formation, but also for the treatment of the carotid thrombosis. Full stop. Corrections made. Yeah. Then next we'll go to phase 3. Providing information is over. Next, phase 3. Offering reassurance. Okay, offering reassurance. Yeah, offering reassurance. Yeah. Offering reassurance. Okay, nurse. I read in the newspapers that people are dying due to strokes. There might be a possibility of strokes in the future, and I might die. What is your notion about it, nurse? That is, patient is telling. Then, nurse. That is a wonderful question from you. I would like to inform you that your current condition is a stabilizing. Stable. Stable. There is nothing to be alarmed about. If you comply with the doctor's suggestions, which include periodic blood checkups and implementing the lifestyle modifications, you can avoid failures, future occurrence to a drastic extent. There is no failures, it's future. By mistake, I read it. Yeah. Come and write down your dialogues, na? How you will write. Because this discussion we can have session, personal sessions. Now the patient, Michael Jackson, is telling. Are there any other measures apart from these medications to prevent strokes in the future? And now the nurse will say, it is commendable. You are seeking valuable information. Lifestyle, not only lifestyle modifications, but also dietary modifications. It is always good to anticipate a problem before it actually arises. Weight reduction is of utmost priority to curb complications. Suggestions are mine, but implementation of the suggestions is yours. I cannot compel you, but I can ensure you that it will give an invaluable experience to your life. Come on, write down your sentences, all of you. Michael Jackson. Yeah. I will follow all the suggestions in order to lead a normal life. Nurse, thank you. Is there anything else I can do for you? Now the patient. No, nurse, not for now. Thank you. Okay, Mr. Jackson. If you have anything to be addressed, please press the buzzer. The assigned nurse will come and help you. So I have given you some suggestions, some sentences, okay? Because I wanted you to give you some sentences, so I requested the coordinator, and she has prepared them for you. Yeah, she will be giving some guidelines like this for every session from tomorrow onwards. So now let us write for everyone in the message, not only to me. Write in such a way that everyone will get the messages. Everyone, keep it everyone, not to me only. Yeah. So you can type your sentences. Fine. Now here I am. Yes. You can write your sentences, whatever you have. You can ask questions, your doubts, your queries, and everything. Whenever I take lectures like that, be available, because afterwards, whatever time, okay, if you are doing some test also, you can break it up and you can attend the session, because sessions are very, very important, especially for the new students and for the exam goers. Okay. So, right. your sentences and submit now. Okay, now let us see. We can start individual sessions afterwards. Prepare very nicely. You can prepare this card very nicely. Come. Okay, many students have given many sentences. Oh, yeah, of course, you can ask, Kamal. Definitely, you can ask. If you feel that they are relevant to the information stroke, yeah, maybe important. Drinking and smoking is important. If you feel that it is relevant, you can ask. Definitely, relevant questions you can definitely ask, Kamal. That's absolutely right. Yes. So if you have any doubts, you can ask me. Okay. How was the theoretical session? This is theoretical session. Theory part. How was the theory part? Okay. Was it useful? Was it useful? So write down everything. Okay. Now prepare this one and use it. No need to panic. No need to worry. Yeah. So Rifa was very knowledgeable. Kamal very useful. Rajeshwar, it was good. Rifa learned a lot. Very useful. So informative. Kamal. Yeah. So prepare all these points on these grounds. And next we'll be doing one very beneficial. I will. Okay. Next, shall I schedule one writing session? Next one. Shall I schedule one writing session? Okay. So shall I schedule one writing session? Not now. After my fast, breaking fast. I will have a break. Okay. I'll break my fast around 5 o'clock. Then maybe say 5:30 or 6:30. I can take. So shall we schedule? What time can you schedule? Uh, so uh, I'll give you a job work. Can you do one thing for me? So find out all the authentic tasks, writing tasks. Every day we do one writing like this, like one speaking, one writing every day. So what you can do is you can coordinate with our coordinator Meera, and then you can take her help. One speaking task like this, one writing task like this. Okay, she'll be mostly busy with many things. So I want you to coordinate with her, and I want you to schedule every day. So tomorrow, which writing task and which speaking task? Okay, you have to do. Are you ready to take the responsibility? Are you ready to take this responsibility? So you have to schedule. So are you ready to take this responsibility? So you have to take one. Yeah, let me call you on the video. You can start your video here. Yeah, I will. I will means my mother used to tell I will tablet those days. 2019, not 2000, 2000 my mother passed away. 1994 or something. Yeah, I will start your video and unmute. Yeah.
Yes.
Yeah. Where is your video? I cannot see you. Yes. Okay. So you are there on the screen. So your responsibility for 1 week, I
Yes,
want
sir.
a task to be done. Speaking task like this. It is your responsibility. Every day in the afternoon, exactly at 2 o'clock, we'll do one speaking session like this. You have to plan different things. Take the help of Mira and plan. Okay. Daily and schedule and send that schedule to me. Okay. Or directly in the group you can send it. Right. Then in the
Yes.
same way, one writing task. For example, tomorrow you can take Peter Dunbar. Day after tomorrow, Annie Hall. Like that one, different case notes. Then and that we'll schedule at 5 o'clock. 5 o'clock we'll schedule or 4 o'clock. So speaking at 2 o'clock, daily speaking session. Daily speaking session, 2 p.m. Okay. Then daily writing session, nurses at what time? 4 p.m. Yeah. Evening we are doing reading or listening. That is different. So that's it. So these for 1 week I want you to plan and send me. Okay.
Yes, sir.
Okay, fine. So you can stop your video and your audio. Yeah. So we'll be having these schedules on a daily basis. Okay, for 1 week. Afterwards, we'll see if it is very useful. Then we'll do more of these sessions. Now, I want to ask you, how beneficial, you have to tell me, are these theory sessions? Practical sessions is when I call you one individually. Okay, that is practical session. This is theory sessions. Yeah. How beneficial are these theory sessions? 0 to 100%. What is this? Yeah. If you say they are very beneficial, then we'll take directly for 1 week. Okay, we'll schedule. If everyone is interested that we are learning some things, because new sentences I'll be giving you, and everyone will write their sentences and everyone will submit their sentences. So we can learn a lot from everyone. If you're comfortable with this, we'll go ahead. Yeah. So that's the end of the session for now, and we'll join after break. I'll send you a new link for writing. Okay. So Avil, you can select any one writing task. Check whether it is authentic or not. So that's the end of the session. And if anybody is interested in such sessions, you can just get back to us at +91 98 67360. So yeah. Yes. So +91 98 67360. So that is the contact number. And if you're interested, you can contact on WhatsApp for this number. So Right. All of you can write your sentences and you can submit. That's the end of the session for now. See you again. Yes. Have a nice day. Meet you in the evening session for writing. How many of you are interested for a writing lecture? Write your names. How many of you are interested for a writing lecture? Write your names. Yeah. This one full week, we have open sessions because from January, new batch is coming January 2nd. So open sessions till December 31st. From Christmas to New Year, all these sessions are open and free for everyone. But writing corrections and speaking sessions will be only for the regular students. Lectures are free for everyone. For this 1 week, consider as a demo sessions. And if you are interested, you can join. Yeah, recorded session is already there. So it's already there, recorded session. I'll give you the recording link. Recording link is here. That is there. Yeah. This is the link here. Copy text. Yes, this is the link. You can watch it on the YouTube. So that's the end of the session. See you all. And my number is +919877867360. So that is my WhatsApp number. You can contact me for subscriptions. For this 1 week, all my lectures are free, but writing and speaking, feedback and personal sessions are only for the regular students who have registered with Grand Master class. So see you all. Have a nice day. Bye-bye.